Hi, I'm Melissa Crodel, and I'm doing my introductory speech on where I work. I work for a neurosurgeon's office at St. Francis Hospital. If you're unaware of what neurosurgery does, it involves the spine. Are you aware that the spine has 3 different parts to it? One being the cervical spine, which is located directly below the brain or the skull, and goes down. There's 7 vertebrae in the cervical spine. Then there is the thoracic spine, which is located directly below the cervical, and then you have the lumbar spine and the sacral spine. If a patient is having difficulty in grasping things or having numbness and tingling in the arms or the legs, that's usually the cause of a nerve root impingement or narrowing of the canal, which can also affect incontinence and give you bowel problems. The other issues involved in neurosurgery is slip disc or compression disc, which can make it very difficult to sit, stand, sleep, do everyday activities. What our doctors require is for patients to get an MRI or a CAT scan or flexion extension. They do prefer for you to have all 3, but if you come into our office with just one, they usually end up sending you out to get the other 2 done. They also prefer that our patients go through conventional therapy, whether that's an injection in the spine or like an epidural injection or physical therapy before going into surgery. Unless it's something that is so severe that they know for sure that those things will not work, then they will do surgery. With a microdisc, it's mainly going in and shaving the spine or shaving the disc itself and helping give room and release that compression. With a fusion, it's more involved and it requires fusing the actual spine together, and that is something like this. They actually go in and drill and fuse the spine together. You can do a full level spine fusion or just a 1-level spine fusion. But we have patients that come in wheelchair bound or pushing a walker or using a cane, and 99% of them after these surgeries are walking in just like you and myself. No assistance needed. We even have patients tell us that they are ready to go dancing and they feel like a teenager again, which is huge because a lot of our patients are elderly patients over the age of 60. So it's exciting to see that, and that's why I love my job. There are various techniques, like the MRI is more to discover or find anything with the nerve or the nerve roots. CT is a bony anatomy test to see, to make sure there's no bony anatomy issues. And then the flexion extension is where they have them bend forward and bend back to check for instability in the spine. I love my job. I love the surgeons I work with, and it is amazing to me to see how much of a change our patients go through in just a few months after surgery. A lot of surgeons, like if you're having an appendectomy, you follow back with them one time and then you're done. But our patients are with us for at least a year, just to make sure that everything fuses together or that they're able to get their symptoms resolved. And 99% of the time, our surgeons are successful in doing this. Only if the patient abides by the recovery skills needed to get them to that point. They usually, by their first post-op, they're down to virtually no pain meds to help them with the pain. And of that, we're excited because there is issues with getting addicted to pain pills, so we are very cautious and watch that very closely. If they don't find that they're getting any better, then the doctors order more testing, and it may be an issue other than the spine, but 99% of the time they are able to be successful in getting the patient to the point where they need to be. believe that's all I have to say. I apologize if it's boring, but this is my life and I love it, and I hope you all have a great day. Thanks.